you were one of the companies that readily agreed to be part of the government's program. And through that program, we have been able to extend these services across Guyana. And we have been able to serve thousands of persons across Guyana. Not only were we able to do the testing of their eyes, but we were also able, if they had any problems that can be corrected by spectacles, we were able to provide them with a voucher worth $15,000 so that they can access their spectacles. Just recently, a couple of weeks ago, I received some photographs from Danny when his team was in Deep South, and they were going to the villages and working with those villages to ensure that everybody in those villages can have access to health care. So this is the quality of the company. And I think it was a logical next step that having done testing, that you would move on now to do surgeries. And so we're seeing that vision come alive in terms of the surgeries that you can do here. And even before this official opening, you were able to do some surgeries here that were already groundbreaking. So I think this is going to be adding a significant contribution to the development of eye care in Guyana. All of you would have heard the president over the last couple of years talking about his vision for development of the healthcare sector. And it's not a vision where, you know, we can think about doing the routine things, fixing a hospital, fixing something, and that would not really help us to leapfrog. But the vision of the president is one where we can transform what we have here in Guyana to be one of world-class healthcare. I know the first time, a couple of years ago, when he spoke about this, I know there were a lot of people who were skeptical. Would this ever happen? These guys are dreaming. But we have seen that whatever he has said, he has backed that up with the resources to ensure that we can do that. Who would have thought that last year, for example, that we would have opened 6 new hospitals? That is something that is unprecedented. It has never happened in the history of this country, and we have seen that this government would have delivered 6 new hospitals. And then it doesn't stop there, because there are 8 other hospitals that are under construction, and there's equity that is involved, because these hospitals are not being constructed in Georgetown. It is being constructed around the country so that people in the interior of Guyana can have access to these facilities. And that is what is important. And we didn't stop there. We are improving, we are using digital health to improve efficiency of our services. We have been investing a lot of resources in training so that we can have more nurses, more doctors, more specialty people, so that we can deliver better care. And that's what, when we talk about the vision of development of health in Guyana, that's where we are going. And very soon, there will be other developments that you'll be seeing, where we want to take the country to another level. A simple innovation that we've started about 2 years ago would be one where we want to go into every school. Every child, when they enter nursery school, we want to ensure that they can be screened. Because if they don't have good vision, they might be sitting in the classroom and they'll be having learning difficulties because they're not seeing on the blackboard. And we decided that we wanted to change that. So we screen children when they go to nursery, and if they have any problems, then we bring them into the healthcare system and we try to fix it. And we've been screening them for hearing, for eyesight. We do a general checkup for them, and if there's any problem, we bring them into the system. We do a repeat of that testing when they're in primary school and when they're entering primary, and we do another repeat when they enter secondary. And so far, we have screened close to 90,000 children. There isn't a parallel program anywhere in the Caribbean. And we must be very proud of that, because That is happening right here in Guyana. And we're not stopping there, because our intention is that every school child would be screened 3 times. And again, there's a partnership between us, the public sector, and the private sector. And that's another one of the planks that the president has been talking about, that we have one healthcare system, and we must be able to have both in the public sector good development, but we must not do it excluding the private sector. And that is why we have been able to do this work in terms of going out, doing eye screening, doing the spectacles with the private sector. And with the labs, we have another program where we have more than 50 laboratories in the private sector that has been working with us. When we pool our resources that we have in the country, those resources can work very well for the people of Guyana. So once again, I want to add my congratulations to the Optique team. I think they have done a fabulous job. They are known for their excellence, and we expect no less from this hospital. Thank you very much, and congratulations once again.
Thank you, Dr. Anthony. At this time,
our president and all other protocols observed. You know, the most lucky part of my job is to see vision comes to execution. Literally, we're seeing it today. And I remember sitting in my office with Danny quite a while ago, speaking about what his goal is for Guyana. And to see it happen literally is a proud moment. The second proud moment, and I know His Excellency will talk about this, is our local private sector has stepped up to major investments in our country. And we should all be proud in this audience to know that our local private sector has stepped up. And, you know, His Excellency, in many of his conversations across healthcare, he says something very, very powerful, that our healthcare system is and will be second to none. And whether it's the public sector that Dr. Anthony will talk about or the private sector, we can be proud as citizens of our country, and even those traveling back to do healthcare in our country and also eye care, that we will deliver that healthcare that His Excellency, and who is, I would say, the visionary of Guyana. You know, you don't have to guess where 2030 and where we will be in 2030. The president has outlined a vision. He's outlined an execution plan. He's delivering every day. Hospitals across our nation is being open. And we know now that we are ready to attract more of the diaspora back to our country. One of the things they requested was better health care. We are doing that, both public and private sector. The investors that are coming into our country know that they are well taken care of across our system, and we are proud of that. So, end of it all, today, it's exciting to see the fact that our own Guyanese is delivering on the commitments of His Excellency, and to deliver 2030 vision, all of us becomes part of that. Thank you, and God bless you.
thank you, Dr. Rams.
Excellency, President of the Cooperative Republic of Guyana, Dr. Mohamed Irfan Ali, Honorable Ministers of the Government, distinguished members of the Diplomatic Corps, esteemed colleagues in the medical fraternity, valued partners, stakeholders, members of the media, and invited guests. Welcome to the opening of the Optique Eye Hospital, which joins the expanding network of eye care facilities serving Guyana, adding and complementing the public health services provided by the Government of Guyana through the Georgetown Public Hospital Corporation and the Regional Hospital, and also adding to the existing private hospital sector in Guyana. This expansion comes at a critical time when the need for eye care worldwide has never been greater. We rarely appreciate the gift of sight until it is threatened or compromised. Globally, almost 30%, or 2.2 billion people, live with some form of vision impairment. It's a staggering figure. Perhaps more sobering is that approximately half of these cases, or 1 billion people, could have prevented or addressed their vision loss through timely intervention and care. The leading causes of vision impairment remain fundamentally treatable conditions such as uncorrected refractive errors like myopia, hyperopia, and cataract, conditions for which effective and accessible solutions exist. Vision impairment is not expected to decline in the foreseeable future, given that the current trends show that another 60 million people will be added to the persons already totally blind, whilst another 500 million people will be added to those that suffer vision impairment. The sad reality is that impaired vision or blindness affects people unequally, with those in poor countries or countries that have underdeveloped eye care or health care are affected more by the leading cause of vision impairment, which is cataract. The impact of vision impairment or total loss of vision is significant, especially amongst children. Vision impairment impacts their learning outcomes, which later in adult life impacts their ability to work or earn a living. It also affects them socially and mentally. Not being able to see and learn affects their confidence, makes them and others believe that there's something fundamentally wrong with them. And if not corrected early, it can cause them to not fully achieve their potential or full productivity. There's an active school vision screening program being undertaken and outreaches by the government while mobile vision testing is being planned for the hinterland communities. Anyone who would have experienced poor vision would know that it reduces the quality of life. In September 2025, the International Agency for the Prevention of Blindness found that every $1 spent in eye health can yield a return of $28. Therefore, apart from assisting the individual, there is real economic benefits to investing in eye health for a nation. The statistical estimates for Guyana show that approximately 78,000 Guyanese live with visual impairment, and of this, nearly 3,000 people are blind. While the country has historically had a limited number of ophthalmologists, I am pleased to see that more doctors are taking up the call in ophthalmology. Over the past few years, we have had about 10 ophthalmologists serving close to 1 million people here in Guyana. The situation in Guyana is compounded by one of the most significant public health concerns facing our country, which is diabetes. Guyana has one of the highest diabetes prevalence rates in South America, with estimates as high of 15 to 17% of adults between the ages of 20 to 29, as estimated by the World Diabetes Foundation. And in 2030, this number is expected to rise. The link between diabetes and eye health is direct and devastating. The Guyana Eye Care Strategic Framework estimates that almost 20,000 Guyanese suffers from diabetic retinopathy, which is a complication of diabetes. It is a blinding disease, which threatens the sight of nearly 5,000 of those patients. Of course, I'm very encouraged and hopeful that these numbers can be reversed, given that the government of Guyana has demonstrated a strong and sustained commitment to improving vision health for all of our citizens. It would be remiss of me if I did not mention the diabetic retinopathy screening and treatment program, which was developed in 2016 by the Georgetown Public Hospital, the World Diabetes Foundation, Orbis International, and the Ministry of Health. This allows for diabetic retinal examinations to be offered free of cost to persons with diabetes. In the private sector, the Optique Eye Hospital will also be offering this service. The government of Guyana has also launched a 1.4 billion eye testing and spectacles program that is available to every Guyanese. This commitment has allowed for Guyanese to access eye care facilities countrywide, including the Optique Eye Hospital. Hence, there is no reason why Guyanese cannot prioritize their eye health. Optique Eye Hospital is now an added capacity that will provide important eye care services. I'd like to recognize the management and the staff of the Optique Eye Hospital and Optique Vision Care for their dedication in delivering eye care to patients. As we move forward, continue collaborating collaboration between the public and private sectors will be essential as we are encouraged by the government's commitment to improving eye care. Thank you.
Thank you, Dr. Sugrim. We will co-founder and optometrist, Dr. Madonna Narain, Optique Vision Care, distinguishing itself as the first company to provide employment to optometrists from the University of Guyana optometry program, the first to establish an optic chain in Guyana, and the first to introduce Crizal lens technology, which I am wearing, by the way, an electronic health record system within the optical industry. Ladies and gentlemen, put your hands together for the founder of, one of the founders of Optique Hospital, Danny Naran.
Thank you very much, Len. You make me feel very special. But I think Madonna is the driving force behind me and the success. Your Excellency, Dr. Mohammed Irfan Ali, President of the Cooperative Republic of Guyana, the Honorable Minister of Health, Dr. Frank Anthony, the Honorable AG, Attorney General and Minister of Legal Affairs, Mr. Anil Nandalal, the Honorable Charles Ramson Jr., Minister of Sports, Youth and Culture, the Honorable Colin Crowell, Minister of Housing, the Honorable Zulfikar Ali, Minister of Public Service, Government Implementation, our Foreign Secretary, Mr. Robert Passad, and other members, Dr. Peter Ramsarup, Chief Investment Officer of Go Invest, and other distinguished government officials, member of the Diplomatic Corps, other special invitees, Mr. John Galbraith, International Sales Manager of SLR Luxottica for Latin America and the Caribbean, Mr. Rogelio de Santos, our value partner from Zeiss and Medilex Miami, my wife, Madonna, my daughter, Maddie, she doesn't want me to call her Madison, my father, my dad, Madonna's mom, Auntie Marianne, other special invitees, partners, and my dedicated team. Thank you for being here with us today. And if I may, I would like to recognize someone that is very special to us, Ms. Jem. She's sitting in the blue dress in the corner, our neighbor to this project, living next door, and the oldest resident of New Market Street. And Ms. Jem, I seek your approval yesterday to disclose your age, so I will. At 95 years of age, it is truly an honor to have you here with us today. Ms. Jem often proudly reminds me that she has the distinction of living in the same street as you, Mr. President. Ms. Jem, thank you. Today is a very important day for us. Standing here, I just don't see a building. I see a journey that started with a simple idea and over time grew through hard work, persistent, and support of many people here today. And as I reflect on that journey, I want to acknowledge the foundation on which it was built. My parents, my late mom, and my dad, who is here. Thank you, Dad. Madonna's mom, Auntie Marianne, for your tremendous support with Madison, while we're always busy working. Thank you, Auntie Marianne, and many other family members who are here with us today. Carolyn and Corey from Canada, who unfortunately are not able to be here for today's grand opening. And very importantly, my wife, Madonna, who helped set the foundation and the stage for this journey. Your support, strength, and belief made this possible. And for this, we're all truly grateful. Optique Eye Hospital is not just something we built. It is something we truly believe in. And I must acknowledge Dr. Shailendra Sugrim, whose dedication to patient care and excellence helped shape what this hospital represents today. Today, we honor you for your compassion and unwavering service to this project and to the people of Guyana. This institution stands not just on infrastructure, but on the foundation of purpose and shared vision. From the very beginning, our goal was simple: to create a place where people in Guyana can access quality eye care with confidence, a place where patients feel comfortable, respected, and genuinely cared for. Today, that vision is not only a reality, but we have broadened the scope to include all aspects of eye care in Guyana. This project represents an investment of approximately 1 billion Guyanese dollars. I would like to extend my sincere thanks to Republic Bank Guyana Limited and the government of Guyana for their valued support and partnership. Through our collaboration with the government of Guyana, we were able to align the goals of this project by accessing incentives provided through the Office for Investment, which significantly reduced our capital expenditure for a venture like this. Thank you. At Optique Eye Hospital, we bring everything together in one place: comprehensive eye exam, advanced diagnostics, and now surgeries. We are proud that we can offer full-fledged eye care services right here in Guyana. In the past, patients requiring complex retinal procedures had to travel overseas. Today, those services can now be delivered right here at home. This is a meaningful step forward for healthcare in Guyana. I'd like to share a brief story. About 10 years ago, a young child, Roshan Holder, came to us with severe vision impairment. And Roshan is up on the screen. That was 10 years ago on the left and 10 years after on the right. After treatment, he saw clearly for the first time. I will never forget that moment. Today, he is thriving. He's thriving and living a normal life. The picture on the left, that was the first time he ever saw his grandmother. When we fit those glasses onto him, he was born with, for the doctors here, he was born with a congenital eye condition. And this story reminds us that vision is not just about sight. It is about opportunity, independence, and quality of life. Our mission is simple: to help people see better, live better, prevent avoidable vision loss across our country. To my team, this day belongs to you. Thank you for your dedication. I would also like to extend special thanks to Dr. Hines, Dr. Bob Semple, Ms. Natasha Harvey, and our entire clinical team. And a special acknowledgement to Ms. Daljit Bandari for her role in shaping our clinical standards. Thank you. To Your Excellency and our distinguished guests, your presence here today means a great deal to us. As we open our doors today, this is not the end. This is the beginning. To the people of Guyana, this hospital is for you. We are here to serve you. Our commitment is clear. That is to not only deliver eye care, but to elevate the standards of what is possible within Guyana and the Caribbean. This project demonstrates that with the right partnership, a friendly investment climate offered by the government of Guyana, and commitment, highly complex subspecialty procedures can be performed locally at an international standard. We remain committed to investing in advanced ophthalmic services so that no child or adult has to leave the country for sight-saving care when it can be delivered safely and effectively at home. Because we can improve vision, we just don't change how people see the world. We change how they live in it. Thank you very much.